Hi, everyone. I'm presenting today on the Child Development and Rehabilitation website, User Needs and Plans for Redevelopment. I'm Kim Miller, and I'm presenting on behalf of my collaborators, Stephanie Glegg and John Jacob. Launched in 2005, the Child Development and Rehabilitation website, or as we affectionately call it, the CDR website, was created to offer evidence-informed clinical practice resources, educational modules, knowledge translation, and practice change supports for clinicians who provide child development and rehabilitation services. As you can see from our site, our platform definitely needs updating. 2 years ago, we began reaching out to our users and potential users to learn more about how we could better meet their information needs. We know that electronic knowledge products and resources are most effective when they're tailored to the needs and requirements of our users. Our tactics included interactive workshops like the one we led at this work forum 2 years ago, surveys that were embedded into websites that we oversee, the Therapy BC and the CDR website, engagements with professional practice groups, and also examining our web analytics to see what people were actually using. In collaboration with Emily Carr Health Design Lab and later with BC Children's Hospital Digital Lab team, we used a human-centered participatory design approach that involved use of objects and hands-on activities and focused on creating and storytelling to draw out ideas, insights, lived experiences, and tacit knowledge to help us learn more about the content and the design of the platform. These approaches were used with clinicians and with families and youth from the communities that we serve. From our families and alumni, we learned more about how health information should be. It should be credible, trustworthy, timely, easy to understand, with no medical jargon, and accessible. It should help you to know about resources, where to find them, support you in accessing the resources, people, and information that you need, help you find your way in a complicated healthcare system, and help you to make informed decisions with your healthcare provider. So a collaborative decision-making approach. While our families and alumni said in person or by telephone was preferred, online information could be helpful to them. In response to this, we're redesigning a new family portal on the CDR website. And this is designed to support them in making informed decisions about their care with their provider. In addition to literacy-friendly downloadable resources and tailored media for diagnosis and monitoring, management, and treatment, curated links will be provided to community services, funding, and peer supports. On the clinician and teacher side, we're going to be revising and updating content curated to support evidence-informed practice and practice change in the child development and rehabilitation sector. Unique resources created here in BC will be highlighted. But we won't be throwing the baby out with the bathwater. From our surveys, we know the content that current users value, including e-learning modules, evidence-centered resources like the Evidence-Based Practice Toolkit, Seating and Mobility and DCD resources, school-age therapy resources like the Printing Like a Pro resource, Hypotonia Wheel, Positioning for Hip Health, and evidence syntheses like the Evidence for Practice and CADATH reports are all resources that are valued by our current users. What I'm showing you here is a summary of what our users told us they were looking for if we were going to redesign the website. First and foremost was visual appeal. They wanted the website to have less clutter, to use larger fonts, to use icons, to use graphic design principles to make it easier to understand and easier to find what you were looking for. They wanted it to be interactive, if possible, including a chat forum so that they could connect to other therapists, and certainly providing opportunities to contact for feedback where there were broken links, a request required for resources, or even recommending resources that should be on the website. People wanted to have alerts to new content, to perhaps subscribe to an email list that allowed them to know when new resources were being put up, and to have reminders about what was new on the website. Further to that area of personalization, they wanted to have customizable resources, and they wanted to be able to print customizable worksheets. They wanted it to be accessible. They wanted it to follow best principles in terms of accessibility, to include more languages where possible, to clearly state the purposes of the site, and to certainly have less jargon for families, teachers, and others that might be using the site. They wanted improved access. So they wanted to be able to find it when they typed that website name into Google. So SEO optimize, link to the BC Children's and the Sunny Hill sites, and also the Therapy BC website. Finally, and very much emphasized because there's such a large volume of content on this site, was to improve the site navigation. So they wanted to be people to be able to, when they go to the site, find what they were looking for, but at the same time facilitate those accidental and joyful discoveries along the way. They wanted it to be quicker to load, to maybe include how to use videos or a tour on the homepage, to have highlighted where the most accessed content was, to be able to preview documents before having to download it, to very much involve fewer clicks to get to the resources that you need, and to have a better organization of those links. Finally, to have a better search function overall that allows you to find what you're looking for, and to have an intuitive search algorithm integrated into it to allow that. So John Jacob and his team at BC Children's Digital Lab have created this first mock-up that will continue to be refined. And certainly what this new website will incorporate is artificial intelligence navigation systems with machine learning algorithms to help users easily search what they need. So they'll be able to type into a global search bar like this, like you would on Google, and find what you're looking for. In addition, what they've recommended is a recommendation algorithm that asks questions to learn more about the user and their interests so that it can help you to find what you're looking for. It'll have featured resources that are popular so that it helps you to get to those most popular resources, as well as persona categories and resource categories, once again, to facilitate getting quickly to where you need to go. When you are searching for something, it will give you matching resources and also give you the option of letting us know when we should be giving you, including other resources, or when you couldn't find what you were looking for. On the category page, it should have useful information along the side, supports, and other subgroupings that make sense for you to navigate. And this is where we're at. We're at that point where we're trying to figure out what our information hierarchy is. What are those headings and groupings that we should use so users can find what they're looking for, a way that makes sense. And so currently we're doing this, and we're also working with content experts and advisors to update current resources and find and review recommended resources and links that address gaps that were identified by our users and potential users. So I'm at that final stage where we'd like to invite you to be involved if you would like to, and I've provided my email here. The goal of the CDR website is to establish a knowledge and learning platform and resource library that facilitates the provision of high quality evidence-informed care for children with disabilities with and for their families here in BC. And we hope to have a beta version launched in the fall. If you would like to be involved, please email me, and that involvement can be a quick session just to provide us feedback about that design, or it can be more involved in recommending or reviewing resources. Thank you very much, and I look forward to your questions.